very much, Mr. Welch.
Thank you, Mr. Chairman.
The last panelist, which is Mr. Doyle on H.R. 6114. I also want to thank you for what you're doing for our veterans and for serving on this committee as well, Mr. Doyle.
Thank you, Mr. Chairman and Ranking Member Miller and members of the subcommittee for including H.R. 6114 in today's hearing. I introduced the Simplifying and Updating National Standards to Encourage Testing of the Human Immunodeficiency Virus Act of 2008, also known as the Sunset Act, with my friend and colleague Charlie Dent, to correct an anachronism in our veterans' health care laws. Congress does not often step in and tell the Veterans Administration how to diagnose and treat patients in the system, and I think we can all agree that is wise. However, in 1988, Congress passed a law that requires the Veterans Administration to obtain a patient's written consent before being tested for HIV, the virus that causes AIDS. While that might have been a best practice in 1988, it's now outdated and needs to be repealed. According to the VA's Public Health Strategic Working Group, 55% of HIV-positive veterans had already suffered significant damage to their immune system by the time they were diagnosed as HIV positive. These veterans have been to VA to get medical care an average of 6 times prior to diagnosis. That same panel says, and I quote, "The bottom line here is that we are likely dealing with a situation where there are thousands of HIV-infected veterans who are unaware that they are HIV positive. This is unacceptable to me, and it should be unacceptable to anyone else who cares about the public's health and the well-being of our veterans." The face of a person with HIV/AIDS has also changed since 1988. Today, 53% of VA patients have a risk factor indicating a higher prevalence of HIV, but only 35% of that higher risk population is tested. The barriers in current law make testing a disturbingly rare occurrence. In 2006, the Center for Disease Control released guidelines that recommend that HIV testing become a normal part of medical care where appropriate. After reviewing all of the clinical data, CDC strongly believes that separate written consent for HIV screening should no longer be required. In the administration's budget request this year, the VA identified this issue as a problem that needs to be fixed quickly. Concerns have been raised that the CDC's new guidelines don't go far enough to promote HIV prevention counseling. That debate is reasonable, and I understand that the VA is open to discussing that issue with veterans and other stakeholders. That is why I drafted my bill to be agnostic on how the VA should proceed after the current regulations are repealed. The VA has pledged to follow the CDC's guidelines and protect patients' privacy by ensuring their right to an informed verbal consent before screening, as they do with any test for a serious condition. Perhaps the current guidelines will be in place for the foreseeable future, but as the profile of HIV changes, the VA should be as free as any other medical provider to update their screening standards without future congressional intervention. I am grateful to the VFW and AMVETS for their strong support of the Sunset Act. I would also like to offer letters of support from AIDS Action, the AIDS Institute, and OraSure for the record. And finally, I want to thank the committee staff for their help. The Sunset Act strikes an outdated law that puts veterans at risk, and it encourages medical professionals to create appropriate HIV screening standards after consultation with veterans, prevention groups, and other stakeholders. I believe that it should be reported out of committee and passed without delay. I thank you for giving me the opportunity to speak today.
Thank you very much, Mr. Doyle. Mr. Miller?
Thank you, Mr. Chairman. I think this is a perfect example of why some things don't need to be put in legislative form so that it doesn't require it coming back before this particular body. I thank you very much, Mr. Doyle, and also our friend and colleague, Mr. Dent, who has made clear to me his support of this particular piece of legislation. I hope that we can move this legislation forward quickly and yield back the balance of my time.
Thank you very much, Mr. Hare.
Thank you, Mr. Chairman, and thank you, my friend, Ms. Doyle, for introducing legislation. It's a great piece, and I wholeheartedly support it. I just had a couple questions. You know, there's still a stigma with HIV, let alone getting the test, and it is seen as a sign of weakness if you have to take the test by some people. And Should the separate written consent regulation be removed? And if so, what will the process be to get consent for the test?
It's going to be verbal consent now, like it is with any other serious test. So basically, when they want to perform the test, they make an informed consent. The doctor has a conversation with the patients. There's protections in there following the CDC guidelines to make sure that privacy concerns are addressed. And then once the person gives a verbal consent, then they can proceed with the test.
Okay, and then how will the results be recorded in the patient's record then?
Well, I think the results will be part of that patient's file, subject to the privacy protections, so that that would only be information available to the patient and his doctor.
And then just lastly, currently patients who get tested in non-VA, in the non-VA world, get an anonymous identifier to ensure their confidentiality. And how will this confidentiality be assured for the vets?
Well, what the VA has done is pledge to follow the CDC guidelines that incorporates privacy concerns into it. And they have pledged in our conversations with them to work with CDC to make sure they follow those guidelines so that patient privacy is protected.
Okay. Well, once again, let me just thank you, Ms. Doyle, for a great piece of legislation, and you and Congressman Dent are to be commended. And I support this, and hopefully we can get this done quickly. And I yield back, Mr. Chairman.
Thank you very much, Mr. Hare. Well, once again, thank you very much, Mr. Doyle, for your testimony today, and we'll look forward to moving this legislation
Thank you, colleagues.
ASAP. Thank you.